A pleasant day, everyone, and to our esteemed panelists. We are the Group 1A, and today we will be presenting a research topic entitled Level of Preparedness and Their First Operating Room Exposure Among Nursing Students. The operating room plays a vital role in nursing education by offering students essential hands-on experience and insight into surgical care. Preparedness in healthcare education includes knowledge, skills, and attitudes necessary for effective practice, enhancing both learning and patient care. In the operating room, students often feel unprepared during their initial exposure due to the demands of quick thinking and precision. Practical experience is essential as it bridges the gap between theoretical learning and real world application.
For the statement of the problem, the study aimed to determine the level of preparedness of senior nursing students in their first operating room exposure. The study specifically aimed to answer the following. First, what is the demographic profile of the participants when grouped according to section, sex, general weighted average, and semester? Second, what is the participants' level of preparedness in their first operating room exposure as a whole and grouped according to profile variables in terms of the following: maintaining sterility, equipment use, OR preparation, swab and instrument control, and documentation. Third, is there a significant relationship between the participants' overall level of preparedness in their first operating room exposure and their demographic profile? Fourth, is there a significant relationship between the participants' level of preparedness in their first operating room exposure in terms of the following dimensions and their demographic profile: maintaining sterility, equipment use, OR preparation, swab and instrument control, and documentation? And lastly, is there a significant difference in the overall level of preparedness in their first operating room exposure and in terms of the following when grouped according to profile variables: maintaining sterility, equipment use, OR preparation, swab and instrument control, and documentation?
As for the research design, quantitative descriptive research design was used to find patterns and relationships using statistical tools in the data in order to quantify and describe the level of preparedness of senior nursing students in the first OR exposure.
As for our participants, we have 139 students out of 214 of Level 4 student nurses, and as for our methods, we utilize stratified random sampling.
For the instrument, an adopted standardized survey instrument with permission from Abu Al-Asiri and by BRYANT in 2024. The questionnaire is composed of the following: demographic profile of participants, and 5 subdomains with 5 items each, namely maintaining sterility, equipment use, OR preparation, swab and instrument control, and documentation.
For results and discussions, let's start with the demographic profile of the participants. In terms of sex, there are 27 male participants and 112 female participants. In terms of general weighted average, 24 participants had 1.0 to 1.6, and 101 participants had 1.7 to 2.1, and 12 participants had 2.2 to 2.6 as a general weighted average. In terms of section, most came in Section B with 25 participants, while lowest number came from Section F with 21 participants. In terms of semester, 126 participants got their first operating room exposure during first semester, while only 13 participants in the second semester.
When examining preparedness based on sex, both male and female respondents exhibited a high level of preparedness. Males had a mean score of 3.89, while females reported a slightly higher mean of 3.95. In relation to general weighted average, the data also reflected a high level of preparedness among respondents, further reinforcing the consistency of the results across different academic indicators. Preparedness was also analyzed according to semester. The results revealed a mean of 3.77 for the first semester and 3.94 for the second semester, both indicating a high level of preparedness. Moving forward, the overall level of preparedness among the respondents was found to be high, with a computed mean score of 3.94. This indicates that, in general, the respondents felt confident and ready in their preparation. And lastly, when we look at the different subdomains of preparedness, Findings show that all 5 subdomains demonstrated a high level of preparedness, highlighting the respondents' well-rounded readiness across various aspects.
For the level of preparedness in their first operating room exposure as a whole and profile variables, there is no significant relationship.
For the relationship in the level of preparedness in the first operating room exposure, there is no significant relationship for the both maintaining sterility and profile variables and the equipment used and profile variables. But for the OR preparation and profile variables, there is a significant relationship, and that is the GWA. As for the swabs and instrument control and profile variables, there is a significant relationship in the profile variables, except for sex. And lastly, for the documentation and profile variables, there is a significant relationship in both GWA and semester.
Lastly, regarding the differences in the level of preparedness during the first operating room exposure, in terms of maintaining sterility, there is no significant difference among the profile variables. For equipment use, this section showed a significant difference while the rest of the profile variables were not significant. Regarding OR preparations, there is no significant difference among the profile variables. For swabs and instrument control, GWA and semester showed a significant difference while the rest of the profile variables were not significant. In documentation, GWA and section showed a significant difference while the rest of the profile variables were not significant.
In conclusion, senior nursing students showed consistently high preparedness across OR domains with little impact from demographic factors, although minor associations were noted between certain skills and academic performance and semester placement. Overall, preparedness was primarily driven by practical experience, simulations, and mentorship, which emphasized the value of personalized, hands-on training within nursing education.
For the recommendations to the university, they should invest in better simulation labs and teacher training to improve student skills. To the clinical instructors, they should guide and support students closely during operating room experiences. To the nursing students, they should actively participate in learning activities and work on improving their skills, especially in documentation and communication. To the patients, they should be informed about the role of student nurses to create a supportive learning environment. And lastly, to the future researchers, they should study more factors affecting preparedness and try to study in different schools for better understanding.